Hello, our special focus today, India's drive against cervical cancer, the second most frequent cancer among women, almost 1.25 lakh a year in India alone. Sadly, despite all this being extremely preventable. And I'm being joined by Dr. Sharda Jain right now, who's a gynecologist. Thank you very much, Dr. Sharda Jain, for joining us. Explain to us how critical the cervical cancer challenge for women in India today is.
As far as country is concerned, cervical cancer prevention is a big challenge because the total maternal deaths because of pregnancy are 25,000, but cervical cancer deaths are almost 3 times than the total maternity deaths. So I think it's a very big issue. The country does not know, the women of this country does not know. And majority of the, even doctors do not know about this, that this is such a major issue and we have to do something.
Well, doctor, so what's the plan of action really? What's the government looking at? I understand there's a vaccination drive that the government really seems to be looking at right now.
See, we have not started working on it. The Western world has started working on it for the last 65 years. And that's why, just they were on the screening and they have decreased the disease rate of HPV infection in the community by 70%. And as far as the HPV related cancers are concerned, they have decreased by 80%. We have not started as yet anything. Our vaccination rate is less than 1%. Our screening rate is 3%. And our, how to treat precancerous lesion is also around 10%. And this particular disease, which is called cervical cancer, is 100% preventable. It was 100% preventable. I think the ministry wants it. The doctors are ready. I think we have to take it forward. And that forward is WHO says it has given a mantra of 90, 70, 90. 90% of adolescent girls by age 15 should be vaccinated. That's number one. Secondly is 70% of the people with cervical cancer. And thirdly, 90% of the people who are diagnosed to have precancerous lesion should be treated effectively as to have 100% elimination of cervical cancer.
Now, Doc, how rampant is this really? I mean, when I'm asking that, how disconnected or interconnected for that matter are the issues of cervical infection, warts, or cancer?
See, as far as the HPV infection is concerned, it is seen that it is prevalent in our country to the tune of 6 to 7% of population has it. Now, everybody who has HPV infection does not have warts. Everybody who has HPV infection does not have cancer. Very small percentage of people have, but it's an overpopulation. Even 6 to 7% of people in our country, if they are infected with HPV, it brings a lot. And if we give, it is said that, if you give any population vaccination, you bring down the load of the disease by 50%. And I think, on that area, the government has to chip in, because if 90% of adolescents have to be vaccinated, somebody has to fund it.
No. Right. But when we look at 75,000 deaths a year, could you put these numbers in context for us, please?
Every 9 minutes, one patient we are losing of cervical cancer. Every 5 minutes, we are losing a person as a result of HPV-related cancer.
Well, I have to admit, I had to read up on cervical cancer to interview. I didn't know much about this as well. But what would you want to tell young women listening to you?
See, I want to tell them that HPV infection is a viral infection, which is a sexually transmitted infection. And the young adults and adolescents are sexually active these days. and they are bound to get it. Before they are exposed to sex, they must have a vaccination to them. And it is not only girls have to take it. If cervical cancer has to be eliminated, then in particular case, even the boys have to take it. Now we have indigenous vaccine available, Cervavac, coming from the Serum Institute of India, which is less than half of the price of the Western vaccination, which are available. Very effective, very robust data as far as Cervavac is concerned. I think, now people should not have any hesitation to pick up a vaccine which just cost them 2,000 rupees.
Yeah, but if we are looking at a vaccination drive like the government is planning, perhaps later this year, mid of later this year, targeting the adolescent girls, particularly in schools, encouraging them to take these vaccinations and screenings as well. How are we looking at making this more inclusive and reachable, particularly looking at the cost of these vaccines largely?
Our expectations are that the government should take care of the adolescent girls before the age of 15. And now in this particular country, almost 97% people are going to up to class 5. So this is not the big issue. In the school itself, the child can be vaccinated. There will not be any feasibility problems as far as giving the child vaccination. And I find, all adolescent girls by age 15 should be given vaccination by the government. That will take away a big load. And second part is screening part has to be done both in the government sector as well as in private sector by the gynecologists and as a screening method, which I think should be doable.
Well, Doctor, last question, and since you're mentioning screening as such, when it comes to breast cancer, now most people are aware that after a particular age, one must get yourself screened annually. Is there any medical hygiene or best practices that must be followed in terms of cervical cancer, or best to avoid it or detect it earlier on?
The question is that you've raised a very good point. As far as the breast cancer survivors are concerned, they are coming forward. They are creating a public awareness along with the health community. It is doing wonderful job. You find all celebrities are joining in this particular activity, which is called breast cancer cannot be prevented, but the early diagnosis can be made as far as the breast screening of any lump is concerned. But as far as cervical cancer is concerned, because it's a sexually transmitted disease, people are hesitant to talk about this in public. That's the main thing. Now, this particular vaccine, both by the gynecologist and pediatrician, is being promoted as a cancer vaccine because not only it takes care of the cervical cancer, it takes care of the vulval and vaginal cancer, it takes care of anal cancer, and it takes care of throat cancers also. So I think, along with this, it also takes care of the warts. Because when both girls and boys, if they get warts, they are definitely scared and, they are worried about it, that, what has happened to us. So I think, once this vaccine is promoted as a cancer vaccine and for prevention of warts, I think it will have a great impact.
Thank you very much, Dr. Sharda Jain, for joining us, for giving us the details in this particular case. And even as government moves on with this drive, hope it is implemented with all fervor and is inclusive with maximum reach. Thank you very much, Dr. Sharda, for joining us. Well, India Alliance, the opposition